the next tab we're going to look at is Patient Assessment. Down in the lower left corner here, I'm going to click Add, and it takes me to this screen. You'll notice with this particular setup on the right hand side, I have all sorts of times that are noted. With this report, I inputted the times for the call, and what it does is when I click Assessment, it automatically takes me to Add Patient side and gives me that time. If you remember from the first video I did on the trip portion, the first tab here, I stated you can come to the Outcomes tab and input your times before you move along in your report, and this is one of the areas where it helps to do so if you can do that. Or at least put your times in before you get to Assessment, Vital Signs, and Interventions. Just makes life a little bit easier. Not that you can't add an assessment or anything else. If I do put an assessment in without any times, it will automatically give me the exact time. It would give me 13:54. Where that might be an issue is if something occurred an hour ago or an hour and a half ago that we did, if we had a delay getting to the hospital or delay at the hospital, because it only gives you an hour window here. So it's 1:20 here. It's only going to let us go up 1 hour behind. So if it's something where I'm adding assessment after the fact without any times already put in, and I go beyond that hour time limit, what I can do is select Can't Find, and then put the time in there, and then hit Tab, and it'll allow me to do it. And then I can simply move forward from there. But for the purposes of this video, we have already put in the times under the Outcome tab. So we have our time selected. I hit Tab, Who Performed. It gives you the first 2 people on the vehicle first. That's who it lists, and then anyone else who might be on the call if you've already put those people in. If not, it gives you this list of lay people, bystanders, etc., and then also gives you everyone else that is on your department, should they have shown up on scene and for whatever reason. Comments are allowed if you have for some reason have a comment you want to make about the assessment. Airway, again, some more in-depth menu options here, but for this patient we will put Patent, hit Tab. We'll go through our list. Circulation was assessed through radial means. Mental status ANO times 4. Normal neural activity. No blood loss. Normal skin. Now when I tab to the next item here, you notice it says Body Survey. This menu comes up because I simply have not put in a sex or an age for the patient, so it's asking me which one it is. If you have already put this in, let's say a 35-year-old male, then it automatically selects the adult male for you. It takes me to this little screen that allows me to specifically tell the program what's going on with the patient. Now down here I have this thing that says within normal limits. One thing we don't recommend using this for is to document everything that's within normal limits. So if the patient only had arm pain, you don't need to document the rest of the body as within normal limits. Only document your pertinent findings. So if we continue our patient assessment from before, I can click on the chest, and then we'll find pain, and it'll document that as the patient having chest pain. Down here, if I click this button, it gives me a list as opposed to an actual diagram of a person, and allows me to just pick from a list. Click back here and it brings me back to the body. Currently we're in body to injury setup. If I click injury to body, it simply reverses the 2 fields and allows me to put an injury to a specific body part as opposed to a body part to a specific injury. If I click annotate, it allows me to draw if there's something specific I want to point out on my report. And it will print up, that's a horrible arrow, it will print up just as you see it here with the body and then an arrow pointing. When I'm done with the survey, I can go ahead and click Done. If I need to get back to the body survey, 2 options. Click here at Body Survey again, or the little Body Survey icon on the left side of the screen. If I need to replicate the current assessment, this little icon with the 2 pages stacked will replicate the current assessment I have open. If I need to add a new one, the little page with the green plus next to it will add a new one. If I want to delete out my current assessment, I simply click the red X and we can delete it out that way. Next we'll click on Impressions. Here we'll just be noting our primary and secondary impression as paramedics as to what we feel the patient is experiencing. The nice thing about this field is we just click twice and it fills in both the primary and the secondary First click being primary, second click being secondary. This list is pretty familiar as we see it quite a bit. It is a nemesis list. Again, primary and secondary impressions being a nemesis compliancy issue, so we must answer it. Click down to trauma. If there is trauma associated with the incident, we can note that here. And just like our chief complaint menu, there's multiple things we can select. We can also note pertinent negatives and also deselect with the third click. All sorts of menus here as well to go through. You'll notice some like motor vehicle accident will have a lot of different things, and once you note a motor vehicle accident, it's going to require you to answer certain things like type of safety equipment and if the airbag's deployed. Again, compliancy things with both State of Illinois and nemesis. We have the little mapping system up here so we can follow which menu we're in, and we can go back one step if need be. So this one there is none, so we won't note anything there. Intent of injury, unintentional. Possible injury already defaults to no. Since this is required per nemesis to actually log if there's a possible injury, it automatically is going to default to no on every patient you input. However, if you select medical trauma or trauma patient as your outcome, then it will require it to be a yes. If there is possible injury is marked yes, it will require a mechanism of injury. Those two are linked. And it will also require intent of injury. So ETOH drug use is also defaulted to not known. The cardiac arrest tab can be used. You can note everything here. And simply click down your menu here, and it'll give you a lot of different options. That's it for the patient assessment tab. The next one we'll talk about is vital signs.